thanks for tuning in. Today we're going to be going over Pde-5 inhibitors. So this is one of several classifications of medications to treat erectile dysfunction. So before we go through all the meds, I'm going to go through general side effects. So it's going to be hypotension, stuffy nose, which you also find with Flomax, headache, syncope, and dyspepsia, like indigestion. Another thing to know, a contraindication is if your patient is on nitrates, such as nitroglycerin, they should not be prescribed a Pde-5 inhibitor because it can cause a systolic blood drop of up to 35 points. So, the types of Pde-5 inhibitors are Avanafil, Levitra, which is the brand name for Valdenafil, Viagra, which is Sildenafil, and Cialis, which is Tadalafil. So the onset I have for some and the duration for others. So Avanafil is 15 to 30 minutes prior to sexual intercourse. So if you are trying to remember the quickest one for your patient, Avanafil, and I remember because it starts with A and that's the first letter in the alphabet. One thing to note that I wanted to say is a patient must already have an erection, so these do not cause an erection. A patient must be erect, and this will help potentiate the erection, so let's help it continue. Another thing, so the mechanism of an erection, the molecular basis, is that nitric oxide is going to lead into the pathway, and Pde-5 is one molecule within the pathway of an erection, so we're inhibiting one molecule, not the entire step. So that's what helps with potentiate. So moving on to the second drug we have here, Levitra or Valdenafil. I remember there's a V in both of them. This one you have to take 1 hour prior to sexual intercourse. So I remember if you want to levitate, you have to take the pill 1 hour before you can levitate. So the next one, and most common, Viagra, Sildenafil. This one, the onset is 30 minutes to an hour, so just a little bit before, and the duration is 4.5 hours. So moderate onset, moderate duration. Last is Cialis or Tadalafil. So Tadalafil is called the weekend drug. You can take this daily or PRN, but the reason it's called the weekend drug is because it lasts for 36 hours, so quite a long time. So a lot of patients choose this one. Something to know, another side effect I forgot to do is that all these drugs can cause color blindness, except for Cialis. So pilots cannot be on these drugs. Cialis, interestingly, causes back pain, but not the vision problems. So it's kind of a joke that the weekend drug causes back pain because you're doing something all weekend. So to conclude, these are Pde-5 inhibitors. They're one of several med classes for erectile dysfunction. Another thing you can use is Caverject, which is an injection, or there's a triple injection. It's the 3 Ps. It's I can't remember the names of them, but it's 3 Ps, and it's just a penile injection into the corpus cavernosum. There's also like a vacuum device. That's the only thing Medicare covers. And there's pumps, prosthetic pumps, but those aren't used that much anymore. So thank you for tuning in.
Delay with fatty meals.
And Levitra and Viagra, both of these ones, if you have a fatty meal, that's going to delay the onset an hour. So you have a nice romantic steak dinner and you take your Viagra, expect things to happen about an hour later. Thank you.